Hello, my name is Jose Perez, and I'm here to talk to you today about Texas maternal mortality rates, how they affect black women, and what roles government and racism play, and what is being done to combat the issue. A system that enables black women to die at a high rate is a system that is flawed. And while black women are being routinely looked over at a political and medical standpoint, organizations such as Sister Love and Black Mamas Matter Alliance work together to combat these issues and work against attacks on reproductive rights and justice. Black women are leading the way at a local level, statewide level, and a national level to combat these high rates. Although, according to PBS NewsHour, Texas is still leading in maternal mortality rates among black women, and that black women are twice as likely to die at childbirth than white women are. One can still have the same upbringing, the same background, and still be affected by racial disparities in the medical professional field. According to the System of UT and Population Health, the collection and data analysis can also be flawed due to these disparities and confirm that racial and ethnic disparities still exist in maternal mortality rates and that almost 90% of these deaths are preventable. And according to a Harvard study, the data is clear. The diversity in the medical field hinders the rates of black women dying at such a high rate. And if listen to these statistics, we need more doctors, nurses, medical professionals to evaluate black women and be black women, to look like these black women. A big reason for this disparity is racism, experts say. So, how can one navigate the world where medical professionals are actively playing a role in killing black women again? And according to a Texas State Maternal Mortality and Morbidity Review Panel, which found that out of all pregnancy related deaths in 2013, 1/3 of those deaths happened up to a year after childbirth. And that 90% of these deaths, again, were preventable and show that black women were 2 to 3 times as likely to die at childbirth than non-Hispanic white women, regardless of socioeconomic status, regardless of education level, and regardless of health insurance coverage. According to Texas Medical Center, in 2016, Texas was worst in the nation and comparatively compared to underdeveloped third world countries when it came to maternal mortality rates. One would think that providing low cost health care to black women, to people who can't afford it, should be a top priority for legislators. But since it's black women that are dying, nothing gets done politically or medically. The review committee's main recommendation to save the lives of these mothers has been to extend Medicaid coverage postpartum for up to a year. Right now, Texas kicks off mothers after just 2 months of being on Medicaid. Black women are routinely subjected to racism during medical and routine checkups. What are the solutions that are working for others, and how can we improve on what's already been done? We need to continue building coalitions towards universal health care and equitable representation and approach to finding doctors and medical professionals that look like the patient, particularly black women. Black women in politics are leading the way, are trailblazing towards an equitable representation that will change the law and leading the change in the courts and classrooms as well. This is something that we can get done by pressuring local elected officials and changing the laws, changing education systems to funnel more black doctors, more black professionals into these fields to tackle this issue. because it's time more than ever to ensure that people are not dying simply due to the color of their skin. Thank you.